Roseland families. My name is Michelle Leeson and I am the principal at Roseland Elementary. On behalf of the Roseland School District, I am here to share another important message from our friend and community partner, Dr. Agudelo from Santa Rosa Community Health. She will be sharing up-to-date information with you about the COVID-19 vaccine. Thank you and be well.
Hi, good morning. I'm Dr. Agudelo. I'm one of the doctors at Santa Rosa Community Health, and we are here to send a message to our community about COVID, the importance of the COVID vaccine, and how to continue protecting ourselves. It's really important because we haven't really found a way to stop the spread of COVID and this pandemic up until we developed the vaccine. So we were doing things like socially distancing and wearing a mask and washing hands, which is really appropriate whenever you want to stop the spread of something, right? In this case, a virus. But there's really no way to make that virus go away unless we use a vaccine, which is the same that we've done in the past over decades and decades to stop the spread of viruses that are really deadly. We're currently getting vaccines from the federal government. They come to Sonoma County, and then at the county level, they work with our clinics and different medical institutions to determine who will receive the vaccine when. We go through phases. So the first phase, 1A, is basically healthcare workers that are at the front lines, the people who are most likely or at most risk of being infected by COVID-19. We'll move on to the next phase, which is essential workers. So that will be people who work at the supermarket, places where a lot of people frequent. They're not necessarily healthcare workers, but they are in the front line and at high risk for being infected, as well as our elderly population, so people 75 and older who are at high risk of developing a critical illness if they become infected with COVID-19. I think it's understandable to have many questions about the vaccine, its safety. People feel like it's too soon. People don't know about all the different clinical trials and steps that a vaccine or a medication has to go through. So I think it's really normal, and it's really important to, first of all, get your information and your facts from trustworthy sources. That is really important and critical. This is a safe vaccine from a clinical standpoint. It does, it has side effects that are well known. We know that people can develop a fever, they can become, develop headaches, have some soreness, muscle aches. Some people, like myself, who have a history of anaphylaxis, which is like a really, really severe reaction to something, have to carry an EpiPen, and for that we have sort of like a separate recommendation. But the majority of the population just develops headaches and fatigue and muscle aches, and those are side effects that we are expecting. But from the standpoint of safety, we know that it went through all the appropriate steps that any vaccine goes through. It was just expedited because we put in so many resources as a government. The government, not necessarily just federal government, but as a community, the scientific community really came together and expedited things. But this was tested on thousands of people before it was actually approved by the FDA and distributed to all of us. My arm was really sore, and then I had a little bit of a headache, and that's it for the first dose. And then the second dose, which was pretty consistent with the data that we have, and again, my arm was pretty sore, and I did have a headache and some muscle aches. And that was true just for about a couple of days. Some of the people who got vaccinated at the same time as I did develop a fever for a day. And then the next day they were feeling better. They were a little fatigued for a couple of days. And again, the conversation I have with some of my patients is I much prefer that than to become infected with COVID-19 and go through what I've seen some of my patients go through. And I have unfortunately seen many people die from COVID. So that's part of the reason why we are encouraging people to get informed, to really understand how the vaccine works, some of the side effects, and then have that conversation with yourself and your family members to make an informed decision. I got my vaccine for my family, for my community, for my daughter, my mom who's 65, my partner. I wanted to protect those around me and protect myself. But really because I think that from a public health standpoint, there is no other avenue to be able to have a life in community again, to be able to have our kids go back to school and people go back to the activities that they enjoy, be it a concert in the park or church or go swimming. So being able to be in community again and be safe. Masks, socially distancing, washing hands, all of that will protect us, but only for a certain amount of time because we're not really fighting the virus, we're just isolating, which we need to continue doing until we have something that will stop the spread. And I believe the vaccine is what will do that. Remember that we're here for you. So as doctors, physicians, NPs, nurses at Santa Rosa Community Health and the entire health community, we are here to support our patients, support their well-being, provide information from the most trusted sources as possible for us, and to continue to encourage everybody to participate in this effort. Continue washing your hands, wear masks, please don't gather. We always think that it's not going to happen to us until it does. And really get informed and consider the vaccine. Go through that process again with yourself and your family. And hopefully we'll all be able to come together as a community, as a society to move forward and hope for a better tomorrow.